between myself, Pam and Harriet, we've agreed, given the circumstances, that I'll chair this meeting. But it's absolutely wonderful to see you all, and I do hope that you had some rest and relaxation last week, and we certainly haven't started the week quite as we were expecting to, I think, when we went off for the half-term break. As everybody knows, but forgive me for stating the obvious, as of today, England is in a second lockdown period. However, the difference between this one and the previous one that we had in the spring and the summer is that education, if I can use that terminology, so that's early years settings, all schools, all colleges and all universities remain open for all pupils. So that's the difference that we've had. So we've had very little time, you've had very little time, we've had very little time to get our heads round all of that. Thank you to everybody that has sent in questions so far to the school communications inbox. We were aware that there was due to be DfE guidance published. I think between myself and Alex and the team, we felt that we didn't know when that was going to be, and we couldn't let you start today without having something formally issued from the local authorities. So we did send some FAQs out to you yesterday, and then we did get the DfE guidance. So we updated those yesterday evening, and it is our expectation that we will update them following this meeting as well this afternoon with regard to that. Before I invite Mike to come in, I would just like to start, and I'll end probably by saying the same things. You continue to amaze me. You are doing an absolutely fantastic job in very, very, very challenging circumstances, and we all acknowledge that. And most of your questions and queries, I'm sure, are coming from your staff, from your parents, and from your governors as well. So as much as support as we can give you, we will. And obviously I'm liaising frequently, as are the team, with Pam on all matters as well. So you know where to go to now, I think, in terms of immediate support and immediate help as we sort of enter a new phase, I think, in this still national and global pandemic that I think is still, you know, something that we're all experiencing in different ways with regard to that. So you do absolutely continue, and your whole staff, to do an absolutely amazing job for your communities, and we totally recognise that. So even in those very difficult days, please do remember that you know that the response of education will absolutely be recorded as being phenomenal if we ever get to a time when we can look back at this weird and period of our lives, if I can phrase it like that, really. So what I think we'll do this afternoon to maximise the time is, Mike, it might be helpful, I think, if you could just give from your opinion and perspective a quick overview about the decision to move into a second national lockdown, and sort of the science behind that. Obviously, everybody knows Essex itself moved from level 1 to level 2 under the old COVID alert levels. So we were at level 2 ahead of this. But it'd be helpful, Mike, if you could just give your perspective on that, really. And then I think what worked really well last time is many questions were coming in through the chat function. So Pam, if you're agreeable, I think we'll just sort of operate that way again. And between myself, Mike and Alex, we'll attempt to answer those within the time that we've got. And as I said, we'll share them out through updated FAQs as we go forward as well. I think obviously the biggest challenge facing you all will be staffing and capacity around staffing, and that I think is going to be the challenge that everybody will face as we go through the next 4 weeks, really. But Mike, is it okay if I hand over to you now?
Thank you. Yes, thank you all. Thanks for your attendance. I appreciate you're really, really busy, and I appreciate the last thing you needed is, I guess, another lockdown. I want to spend most time on questions, but just to sort of put you in the wider picture here. So you will know that I have been particularly concerned, others have been concerned as well, about rising cases over recent weeks and our inability to do anything much to tackle them. As a result of that, as a result of the exponential growth we're seeing in Essex, as a result of the nascent threat for our hospital activity, and the sense that the sooner we go into this, the sooner we get out of it, we took the decision to move Essex, or to seek the Secretary of State's approval to move Essex into Tier 2. I think the ask to do so and the recognition of a need to do so has kind of pretty much been recognised nationally now, because everywhere now is actually in a more robust lockdown than it would have been possible for us to put Essex in nationally, on the same basis that the cases are rising everywhere and something needs to be done everywhere. That means we've hopefully got a bit of a head start on others in terms of the ability to reduce cases. Given where the R value was a couple of weeks back, and given that we thought that the Tier 2 restrictions, together with increasing work from home, which we were pushing from Essex, would have turned that curve, I have very little doubt that the current restrictions as put in from today, in addition to what we're already doing, we'll see a marked reduction in the level of cases within Essex at the end of the month, which I think would put us in quite a good place after that. We obviously have to wait and see, and it depends on levels of adherence, but my hope is that we will come out of this in a month's time in quite a good place. However, as soon as we reduce restrictions, cases will start to go up again. But I think the timing of this is actually quite good. I think that if we'd gone very early, say half term or before, for a kind of shutdown sort of break, circuit breaker thing, then it's not impossible that cases would have started to rise again before Christmas, and we would have ended up having to do a second circuit break. I think although the cases are now higher than they would have been some weeks ago, I think the fact we're going on this particular time for a month means that the reductions in cases and the continued reduction will continue over the Christmas period. And I think we won't start to see cases going up again until the new year, by which time hopefully the weather may be starting to improve, and by which it seems increasingly likely that there may be some sort of vaccine available, at least for the most vulnerable. So it may well be, by doing this at this time now, that we won't have to see the waves of switch on, switch off, perhaps that we've seen up until now. So that's kind of where all I wanted to say at the moment. I'm happy to sort of, I think, to move to questions if that's more helpful. So happy to take questions about the general position, or happy to take questions about specifics as well. Thank you.
Okay, that's very helpful. So if I sort of start and then add on. So the first question, Mike, is teachers have received an email advising them to stay at home last night. Is it the expectation that it's more of an HR, pay them and keep their classes open and pay supply cover? So that's from Claire. So I'll answer that one if that one's okay. That's not quite a health one really from that regard. So Claire, and we did put this in the FAQs yesterday, so if members of staff have been identified, and forgive the strict terminology, but it is the new terminology, and I think we need to keep using it, of clinically extremely vulnerable, they have been written to, and they have been advised that they should stay at home for the period of the lockdown. So basically the advice is, if they can work from home, to work from home with regard to that. And if they can't work from home, then yes, they should be classed as sick and should access sick pay. So in answer to your question, Claire, yes, the expectation is, and this is the challenge, this is what I meant by staffing capacity, is that the expectation is that schools will remain open, and therefore where you can, you need to cover those classes where you've got staff that will no longer be in for the next 4 weeks or so because they are deemed to be clinically extremely vulnerable. Now, what we need to do, and I think we added this into the advice, is that if your staffing ratios are falling very low, partly because you have other members of staff off sick, other members of staff requiring to self-isolate as a result of positive tests, and so on and so forth, then contact your assistant director as soon as you possibly can, because we understand that that dynamic will be incredibly challenging for schools to manage. So the expectation is that where you can, you will cover. However, if you get another dynamic hitting the school on top of staff absence because they're deemed clinically extremely vulnerable, then contact your assistant director or myself or Alex or whoever, and then we will go through with you what options are available if you are struggling to remain fully open as a result of the staffing levels. So I can't give you an outright answer on that because it will depend on your individual circumstances, but I'm fully aware that at some point sooner, probably rather than later, many of you will be calling us with challenges around how you remain fully open given your staffing levels, and we will try and talk you through that as well. So we're there to support you with that one, because that is what is going to be your biggest challenge over the next 4 weeks. Okay, so just bear with me a second. The next one is for you, Mike. What is the advice for pregnant people as this keeps changing?
So the position for pregnant people is that they would be seen as clinically vulnerable, but not as the sort of the CEV group. So that they would be expected to and advised to very strongly to take particular care, but not to and to avoid, if possible, situations where they may be exposed, but they would not be expected to shield and not be expected to work from home. Well, they expect to work from home if they can work from home, but their being pregnant it would not necessarily mean that they couldn't attend the workplace.
Thank you very much, Mike. There's a question just on the guidance around face coverings, and somebody has actually, I think, attached the guidance around it, but it's something I advise.
Sorry to interrupt you. Before we jump onto face coverings, could we just address a couple of the questions around clinically extremely vulnerable people, just to carry on that theme at the moment? So, sorry, so just a number there. Certainly a couple of head teachers in the chat box saying that they've got staff who first time around weren't sent a letter by the NHS and now have been, even though their circumstances may not have changed, and in one case where their circumstances changed in terms of treatment. So do you know, Mike, if the guidance around or the definition of clinically extremely vulnerable has changed, and how to advise heads on that one?
So I know they've added in people with renal disease and dialysis, and I know they've added in people who've got Down syndrome. I think over and above that, I think there is been efforts to nuance much more, because actually we didn't know an awful lot about the condition first time around, and we know more about it now. So I think there's been work, particularly at Oxford, about defining who is a clinical vulnerable and who is less clinically vulnerable. So, example, in children, far fewer children will need to shield this time than they did last time. It's the individual clinicians who know those people well, who will be best able to advise whether or not somebody should be shielding or not. So I would suggest that, I don't know where they got the letters from, but they need to contact their doctors and get their advice as individuals about the appropriateness of them shielding or not in this instance.
Emma, you put that question in the chat box. Do you want to jump in there and ask anything further around that?
I mean, I think it's just that both of the teachers were quite surprised to receive the letters. They are in the process of trying to contact their consultants for advice, because they're both actually quite happy working in school. And I know under the new the guidance that was sent out today or last night, it does say that if we do a thorough risk assessment to say that they are happy to stay in school, that's okay. But I just wondered what had changed.
So to be honest, I thought most of the changes would be nuanced in a way that more people should be able to go to work, because we know that broad groups are not as at risk as perhaps we might have thought they were originally. But I think it will be nuanced. So it will be down to the individual clinician. So they must talk to the consultants or the GPs to understand exactly where they are. I couldn't comment on individual cases, but certainly I think it is much more nuanced than it was last time.
So also, Teresa, I don't know if you want to jump in around your child with CF, well, not your child, but in your school.
Oh yeah, thank you. So we have a little girl with cystic fibrosis, and she also last time was shielding. We have spoken to the cystic fibrosis team at a hospital, and they've said that she doesn't need to shield this time. What confuses me is that staff with CF have to shield, but she doesn't, and I'm quite uneasy about it, if I'm honest. She's not a very well girl.
So I think that you need to go with what the consultant says what the team says about that. It's important that children get educated, as you know, where possible. I think that I would suggest you go with the clinical advice from those who know the clinical condition the best in that individual case. Certainly there is a move to get as many children back into schools as possible.
Yeah, just hope she's safe.
Bridget, do you want to bring in the issue of sick leave? And I know quite a few people have asked about sick leave, and also around, I'm using the wrong phrase, but a so-called disclaimer for staff who have CEV but have asked or want to continue working. So Bridget, do you just want to jump in there, and then we can perhaps try and cover both of those questions?
Yeah, on the original guidance that came out, it said we could use, if we couldn't find work for people to do from home, we could use sick leave, because it talked about statutory sick pay. I've got somebody that's had quite a lot of time off in the past, so they're quite concerned about it being noted as sick pay. However, at this point, while I have all the children in school, for me to try and find anything that's anywhere near 26 hours a week for them to do outside school, I mean, marking and other things have been suggested, but dropping that off at their house for a teacher to do that, then picking up, is actually going to cause stress for the member of staff that's linked to that TA. And also, I want to backfill that post. Our insurance company has said that we are not covered for this 4 weeks for shielding our staff. So to backfill is actually going to be a cost to the school in addition to paying whatever we're paying. I don't know if they'll open up the window again for being able to claim any costs that are related to COVID, which we've obviously had in the past. So that is a real concern for us, because there's actually 3 members of our staff that fall into this category. How do I stand on if I say I don't want to provide work to be able to work from home, because it won't be anywhere near the amount of work that obviously we are paying the hours for, and I think will cause more stress for staff to be able to prepare stuff and send some things around to people's houses, etc. How do I stand with it being sick leave? As I said, that was on the original guidance, but the DfE guidance I read yesterday afternoon was obviously quite clearly saying work from home. It wasn't saying you should follow your sickness absence policy.
I know we've got Nikki on the line. Nikki, could you come in there?
Yeah, so I'm looking into the issue of SSP at the moment, but the terms and conditions are the problem here. The terms and conditions for both support staff and teachers say, and the guidance of the Local Government Association is that where people are not actually sick themselves but are prevented from coming to work because they're having to isolate, that they are entitled to pay which is not reckoned against their sick pay. But we believe they should be getting SSP, so the school should be getting something back, and I'm looking into that at the moment. You can't record them as sick if they're not, unfortunately, themselves sick. They are entitled to be paid under their terms, and that's also why we should be trying to get them to work at home as much as possible. But appreciate there are some roles where they can't work from home, and there are other roles where it is more challenging and time consuming for you to provide work at home.
It's just work from home when your role is an LSA, which is to work with children.
Yeah, I get that.
If those children are at home, when we were in lockdown before, that was different, because we could use Teams, we could use Dojo, they could be communicating with children, not for anywhere near their full-time hours, but we could get something. However, as I say, you know, marking and things like that, even if they had an admin role or a finance role within school and their back office, that would not be a problem to us at all. But work with children is not going to have a positive impact on outcomes you know, when it's at home, because I can't sit a computer in front of the children that are here and say, oh, this is your LSA, you're working with them now in a room. It doesn't make sense.
I understand that completely. I mean, I think there's a bigger issue here about, you know, funding for the cover that you're having to put in place for the people who are not in work and getting full pay. I think, you know, I'd like to be able to say there's an easy answer to that, but I think it's a bigger funding issue that probably hasn't been recognised in terms of the costs that you are incurring by having to pay people. And the answer that they can work at home is not an answer, because you're still having to cover their presence in school.
Absolutely. So in terms of this though, when we're doing, because obviously payroll's coming up, when we're doing payroll, I can't record it as a sickness absence.
No, you record it as, and I'm just checking with payroll to just be absolutely sure, but I think I'm pretty sure we should be recording them as, and it sounds odd, but accident at work. That enables payroll to claim SSP, so that you are getting some of that back, but not as sick, because they're not sick.
Okay, so therefore it won't affect anything in terms of their sickness and what they've had in that year. So that will at least that will help my member of staff, which is really good, because I didn't want them to be worse off because they've been poorly in the past. Okay, thank you for that.
Okay, thanks ever so much, Nikki. Right, Pam, I'm going to go back to the list if that's okay, because I'm going to lose my place really.
Yeah, thanks, Claire, sorry.
No, that's okay, not a problem, not a problem. We're all learning as we go along, aren't we, with these types of meetings. Mike, could you just say something around face coverings, the safe use of face coverings, visors, which we spoke about online earlier today? Obviously in primary schools, the advice is very clear. There is no change to the advice. Face coverings are not expected to be used by the adults or staff within primary schools, although the advice that we put out to you yesterday did suggest you might want to consider face coverings as part of your visitor policy to the school, just as an extra precaution. And certainly I know many schools have already got that within their visitor policy anyway. But given the fact that there is a suggested, certainly in secondary now, face coverings, as you know, for your colleagues, are mandatory for all travel, for all pupils and adults moving around, so in the communal areas. Primary schools don't have to do that, but there is still something around safe use of face coverings as well in terms of taking them on and off. So Mike, could you cover that one off for me, please?
So thank you. So, and the first thing I would say, and I'd say it every time, but I will continue to say it every time, face coverings are not a substitute for social distancing. Face coverings don't work very well. Social distancing works really, really well. So the important thing is you do not, if possible, get within 2 meters of other people. So I think what's really important is to try and stress that and not relax on that simply because face coverings are now becoming more common. Secondly, the visor issue. A visor is not a face covering. A face covering is something that has to sit snug around the nose and the side of the face. So if you wear a visor, you have to wear a face mask as well. So it's not a substitute. So I think they're the two main things that I wanted to say. Yes, you should avoid taking your coverings on and off all the time. But the important thing about the covering is you're actually protecting other people rather than yourself. The issue about touching it and taking it down is less of an issue than that it's protecting you for others from you blowing out loads of coronavirus all over them and things should you have it. I don't know what more people want to ask or say about face coverings, really.
Does anyone want to jump in? There have been a few questions around this.
No,
looks all right.
Okay, we'll move on. So there's a couple of questions around ventilation and heating, which came up last half term anyway, really. So I'm going to ask Alex to come in here because I don't think we've changed our advice about that, Alex. So do you want to just be very clear about our advice?
Yes, the advice on this hasn't changed. Obviously, appropriate ventilation is optimal to have the windows open, but it's getting colder, so it's kind of accepted that windows will need to be closed. I don't think there was an awful lot more we could say. There was some suggestions about opening the windows to increase ventilation while the children were out at lunchtime and before school and a bit after school, if that was an option. But essentially, the windows will need to be closed when it's really, really cold. We're not expecting everyone to sit in the classroom with gloves and hats and scarves on.
Okay. And just to remind everybody that within health and safety, there is a working temperature that staff are expected to, you are expected to provide in terms of your staff with regard to that. So unfortunately, we can't give you a definitive. It's do the very best you can to create, a room that is, children and adults can be in for a period of time. So if you can ventilate around that, then please do so. But it is a challenge. But it's ventilation, as Mike says. Forgive me, Mike, for quoting you. These are a list of protective measures. It's the sequence of the protective measures. So it's making sure that you're giving everything a go: social distancing, the hand hygiene, the ventilation as much as you can. And so on and so forth. So it is the cumulative effect of all of these. So if you can't do one all the time now because it's much colder, then that's fine. Just do the very best you can. If you've got the others, making sure the others are being followed. And I think one of the advice coming through with regard to the second national lockdown, and you guys were doing this anyway, so this is standard practice, but just really make sure that your levels of hand hygiene, are as high as they possibly can be. And I think that's sensible advice, and you've already been doing all of that as well. So we've been asked about additional funding, so I'll come on to that. So this is something I've been raising with the DfE in my weekly discussions with them. It's something that they're very aware of, that at the moment schools have had no additional funding since September with regard to the additional costs that you're incurring, not just around supply, but obviously around the increased enhanced costs of cleaning, sanitisation, and so on and so forth. They are aware of it, the DfE, fully aware of it. I've been asked to provide some more information to them this week about the impact of the second lockdown on increased costs around staffing. And I was waiting for this call to actually send my reply through to them, so I will do that. So whilst I can't give you any information about whether additional funding will be made available, they're looking at this, is what I can say. So they are looking at this, and they are aware that schools are, at the point where within this term, within this academic year, you are nearing the exhaustion of your supply cover budget, if not exceeded it already, and had to make adjustments to do that far earlier than you would have done in normal circumstances. So leave that one with me. I will continue to lobby on that on your behalf. You just need to do what you need to do basically around that, and we will hope that the government will provide further funding to do that. I think the fact that you're fully open makes a stronger case as well over the next 4 weeks. Okay, Julie has asked around press speculation around vaccine. Mike, do you want to just give an update on what we do and don't know about the possibility and availability of a vaccine?
Yeah, so what we don't know is probably quite a lot. So what's happened is I think the NHS have been asked to step up to be ready and to have plans in place, because it would be inappropriate if a vaccine suddenly appeared and there wasn't the logistical systems in place in order to distribute it and enable people to be vaccinated. So the NHS are at the moment developing very detailed plans on how they can distribute the vaccine. I think they have to have those systems in place by the 1st of December, but I don't think that is reflective of the time at which the vaccines are likely to be available. It may be available this side of Christmas, but I think it's much more likely that vaccines are going to be available from the new year. There'll then be a very protracted distribution program, and I understand that it could be as long as a year before everybody is vaccinated and sorted. The first vaccines will be given to the most vulnerable, and then sort of in sort of declining order down the list. So those people who are in care homes will be the first people to get the vaccine, followed by vulnerable people within the community, older people within the community, but in their 80s, I think they're looking at 85 plus, and then sort of going down levels of vulnerability and age until you get to the wider population. So I think there'll be a fairly clear way in which these things will be distributed, and I think most of us will not be getting the vaccine for some while yet, although hopefully it will be available for the most in need, the most vulnerable, certainly within the next 3 or 4 months. I think it's a bit optimistic to have it this side of Christmas. That's only my personal view, though.
Right, thank you, Mike. And Mike, going back to the point around ventilation, whilst Alex and I have sort of covered it from a logistical, practical point of view, the question is more about how important is ventilation within classrooms in reducing the spread of COVID? I don't know if you have a view on that.
So I think I think you hit the nail on the head. It is one of a number of factors. So I would, I think ventilation is really good in getting rid of a virus that might be within the classroom, but one has to be pragmatic about it. That you can't leave children freezing. So I think it's important, but it's not critical, if you see what I mean.
Great, thank you very much. So there's a couple of questions. There's a couple of questions going back to the clinically extremely vulnerable. Pam, if it's all right with you, I think we'll start with that and leave that to the end, because then we can mop them all up, can't we, really, rather than take them individually.
Sure.
So
I've had I think there's a group of questions, unless you want to keep working down the list, around arrangement of classrooms, and whether a lot of heads are now asking, can we go back to grouped tables rather than just people facing forward? Yeah. So I've had quite a few questions around this. Isabel, I don't know if you're there and want to jump in. I know your camera's broken. Claire, if you want to. I'll read you Isabel's question because it encapsulates what a lot of people have been saying, really. And she's talking specifically about Key Stage 1 in a consistent bubble. Talking about, is there any reason not to go back to groups and so on within a secure bubble rather than facing forward and so on? And actually the question again, which we've talked about before, I think, about whether actually children or young people facing forward, whether that actually increases the risk for adults within the classroom. So just to recover this one, I think.
Yeah, sure. I'll bring Alex in on this one.
Thank you. So I think this goes back to, Claire, what you were saying about the different levels of protective measures. So one of the measures that was put in place when the return to school first was planned was moving children to forward facing. Again, we've said it many times, but your risk assessments is what's going to drive this decision. So if it's really not working for you to have the children front facing, then of course you can move to different arrangements and back to groups of tables. But again, it's kind of just taking away one more of the layers. But if you've still got your consistent bubbles, small groups, then of course, if you need to change your arrangements within the classroom, then you can do.
Thank you very much. And that's a good timely reminder that we've said, changing your arrangements to just update your risk assessment accordingly to do that, really. So thank you very much, Alex.
So Teresa has just jumped in with the, a basic question, but just perhaps what might be worth re-explaining is why is front facing better?
So it basically it reduces the chance of face-to-face exposure, because if somebody's got a condition, so it's probably quite marginal if you're in a classroom for a very long time. But if the children are not facing each other, they're less likely to infect each other. In terms of the bubble, I don't think it's going to affect what happens to the bubble, but I think it is going to affect the number of the children in the bubble who might be affected.
Okay, thank you. And then there's just, so again, there's just a discussion between the children and the adults going on in the chat. So I think we just also reiterate, don't we, that obviously there's more risk between the transmission between children if they're not front facing, because they're not sitting that way, they're sort of facing each other. The adults should, again, where possible, still socially distance as much as they can.
That's the answer, yeah. They could stay 2 meters as much as possible.
Yeah. So you know, that again, going back to this many factors in terms of how you operate. You've been doing all of this, so I know this is heightened in terms of operating during the lockdown, sort of heightened the thinking around this, but it is just, you know, as much as you can, the factors of the many factors of the protective measures that you're putting in place. But the consistent one, which Mike, you were very, very clear about at the last webcast we had, is as much as possible the adults should socially distance as far as they can, not only for their own safety, which is obviously the main priority, but also with regard to track and trace. If they're outside of the 2 metre distancing, it won't be deemed a contact within track and trace, and then obviously we will not need to self-isolate with that regard. So again, movement around the school is more challenging, absolutely accept that, but actually if you can do that very quickly, that's the main thing. So Mike, there was a question this morning that we talked about online around 2 metres, 1.5 metres, the impact on being a contact or not. Do you just want to explain what the decisions are around that?
So as discussed, if you're basically within 1 metre face-to-face of somebody who is infected, then you are at quite high risk and you would need to self-isolate you'd be regarded as contact in that level. Between 1 metre and 2 metre, it's a bit of a movable feast, but generally if you're being in that area within 15 minutes, then you would be regarded as required to isolate as contact. I think greater than 2 metres, then you would not generally be regarded as risk anyway, regardless of the time exposure. So I think the 2 metre thing is quite important in terms of risk. And those figures kind of are what the test and trace teams are working on. Clearly, then there's going to be some variability within that. But generally speaking, 2 meters is very safe. 1 meter to 2 meters, you can do it for a little bit. If you're face to face with somebody less than a meter away and they're exposed, you're at pretty high risk of getting the disease.
Okay, all right. And I think I've confused a few people as well. So apologies if I have. I'm not talking about the children being 2 meters apart. It's the teacher. Absolutely, your children do not need to socially distance. It's the bubble configuration, particularly in primary and secondary, as far as possible to do that. But we absolutely accept that you can't have that. And that was part of the argument going on in the summer, if you remember, about how do you fully open schools if everybody has to stay 2 meters. That's just absolutely not practical. So it is about your children in the bubble, and sustaining the bubble is the mitigation for the 2 meters, and that goes back to the desk configuration that we've talked about. But as far as possible, for as long as possible, and I do appreciate that these are easy things for me to say and very challenging things for you to implement in terms of daily workings of the school. I've seen the daily workings of schools, and actually you're managing it very well. So again, just do the best that you can. I think that's the main thing. At the end of the day, the pragmatic approach is that schools are open when we have COVID prevalence in the community. You know, that is understood and expected, and you are implementing a set of protective measures to keep your staff and children as safe as you possibly can, but within the fact that you're fully operating within the fact that there is COVID in the community around you. And I think that is understood in terms of what you're doing with regard to that. So I do absolutely acknowledge that practicalities are far more complicated on the ground than what's being said here with regard to the guidance.
Claire, can I jump in?
Of course, Nick.
Just to pick up, there are a couple of questions around pregnant staff. I wonder if Mike is able to.
Yeah.
It seems that the Royal College of Gynaecologists are saying 28 weeks over shouldn't be in school, but then you've got guidance saying that they're not clinically extremely vulnerable from the government. So is there any view on that, Mike?
So I'm different views, but I mean, I would go with the government's position on this. I'm sure they would have considered different options, but certainly the government's position at the moment is that they need to take care, but I don't have to be excluded.
Okay, thanks. That'll answer a few questions in there on that. Thank you.
So, and just to add to that, if I may, Nick, so we've had this discussion with the unions directly ourselves. I know some of them mentioned the unions there as well, and would we change our advice as a result of the Royal College of Gynecologists, and Midwifery College, I think, said something earlier as well about the advice. I've said categorically, working with Mike, we have to follow the national guidance on this one, I think, and I think if the national guidance is saying that they're not clinically extremely vulnerable, then we need to go with the national guidance, and I think you're in very safe territory to do that. If you want me to escalate that up to the unions on your behalf, I'm very happy to do that as well, in terms of I'm talking to them twice a week. So if you're getting local issues around your union representatives, let me know and we'll talk to the branch secretaries about that as well. Great. Okay. Right, just bear with me, everyone. I'm still
so there's a question on there, Claire, around testing. I think that's where we got to in the list. So a teacher's daughter has symptoms. The daughter has had a test at a private school that's not her usual school, which has come out negative. The teacher also comes out as negative. Can she return to school? The complication being that it's not a usual NHS test. From the child's school's perspective, they want a normal NHS test. So can we just talk about the different types of test, and in that case whether the teacher could return to school?
Mike, do you want to give a position on testing?
Teachers also had symptoms, right? So she's had a test and the test is negative. It depends what the test is. I mean, if the test is a PCR test, then that, the PCR tests don't have a very high sort of false negative they tend to, so I would think if it is a PCR test, not an antibody test, if it's a PCR test and it's negative, then it's acceptable for the teacher to come back to school, and she doesn't have to be tested. The teacher doesn't have to be tested if the daughter is negative. So in this instance, the teacher, it says that this has come out as if the teacher also comes out saying the teacher shouldn't have been tested, because the teacher is not a case, the teacher is simply exposed. So I think the issue is if the daughter's tested as PCR and it is negative, then the teacher can go back to school regardless of whether she's tested or not, or he's tested or not, if that makes sense, because you shouldn't even be testing the teacher.
Yes, no, that does make sense. So basically, if an individual has symptoms, then they need to self-isolate whilst they get a test and wait for the results. If the results are negative, they can return back, as can their contacts. If it's positive, then obviously they and their contacts household need to self-isolate. And
continue to isolate, yeah. So if they have symptoms, then the family need to isolate. I can't understand why the child didn't have an NHS test. But if they did have another test, we need to know what sort of test it was. If it's a PCR test, then it's probably safe to go back. If it's an antibody test, then they probably need an NHS test before we send them back.
That's really helpful clarification. Thank you very much, Mike. So there was, that's clinically extremely vulnerable, which I said I'll come back to. Now there's something here, Mike, it'd be useful to get your views, because I've had it from a number of places really, about schools being open and the outside rule of 2 in terms of that you can't be outside with you can only be outside with only one other member of your household for exercise and sport. So you've got the social restrictions as part of the national lockdown, and then schools being fully open. So you've got parents taking their children to school, you've got children walking home from school where they're able to. Do they have to adhere to the rule of 2, bearing in mind that they've been in the classroom together in their bubble all day? So there's an interesting sort of dichotomy there with the current situation and the rules that we're in.
Yeah, so and also there's the what's the rules and what's the epidemiology. So from a public health point of view, outside with the same people who you've been in with all day, there is no additional risk at all. But the rules do suggest that they should only be walking home in 2s. It is an odd one. And I don't know the answer, but certainly there is no public health reason why they could not walk home in more groups than more than 2. But I don't know how one wishes to interpret the guidance seems to suggest they can't.
Concern I have there.
I can't say any more than that. There's no.
No.
It is a strange one, and it is a.
Yeah.
Hopefully, more clarity will arise on it. Common sense suggests that that there's no problem.
Emma, do you
No.
want to jump in because you've been asking this question?
Sorry, Emma.
It's just we probably jumped the gun a bit and spoke to our year 5s and 6s about being sensible when walking home and trying to stick to 2. And I've since then had parents come back and say, well, we don't think that's right. They shouldn't be doing that. It's, they're not safe only walking home in 2s. So I was hoping for a definitive answer, which I kind of knew there wouldn't be one. I guess it's a best practice, isn't it?
I think there will be a definitive answer. I just don't think that we're in a place to give it right now. I mean, if they were like walking home in 2s 2 meters apart, so that's okay as well. I mean, it's really kind of, the reality is that these children are not going to spread the infection amongst themselves anymore by walking home together. That's the public health reality.
I think it's about public perception as well, isn't it? If they see a gang of children,
Yes, exactly.
Home, that's kind of where I was coming from, I guess, rather than a health point of view.
And bizarrely, if they were going on the bus together, and they'd be on the bus together, so it is an odd one.
Yeah, let's follow that one up, Emma, because I totally get the public perception point of view. Absolutely. We've had that all the way through this first half term, to be honest with you, and also around parents and social distancing outside of the school gates and everything else. So Mike and I will follow that one up and see if we can get any further clarity on that for you. But also what I don't want is, there has been some negativity around school children during the first half of the term and the congregations of school children to and from school. And I don't want that to pervade now that we've got new restrictions, and particularly around the fact that the enforcement of those restrictions is going to be tighter than ever with regard to that. So I don't want the public sort of, basically phoning up the police to say children are breaching the rule of 2, really, which maybe not primary school children, but certainly maybe secondary. So maybe, Mike, that's one we can perhaps take to the Health Protection Board on Monday.
And Claire, I can feel another letter from you for schools to send out to parents as well, which might help head teachers reinforce some of the messages as we go into the lockdown. I think be helpful.
It's already on the to-do list.
I'm sure it is, yes. Thank you.
That's fine. So we've done so we've got a pregnant teacher whose anxiety is high. Union advises either to medically suspend or find a non-class role. Does this now? I don't know, Nikki, if you've got a view on that one.
Yeah, I mean, I think I'm reluctant to talk about medical suspension. I think if they are sufficiently anxious, they need to go to their GP, and their GP will either sign them off or not sign them off. If the GP signs them off, obviously they're then off sick. If the GP doesn't sign them off, then they either need to come to work or they're on unpaid absence. I mean, it comes back to the individual risk assessment, working with the teacher to try and overcome, or the member of staff trying to overcome those anxieties. But ultimately, they're either signed off by their GP or not.
Okay, all right, that's very helpful. Thank you very much, Nikki. Question from Ginny, Mike, and again, something you and I have been having an email conversation with Adrian. I'm not sure there's much we can say at the moment in time, but I'll be guided by you on this one, around plans to develop regular testing for education staff, which would obviously help improve confidence levels and continue to keep staffing ratios quite consistent, really. And I know that's something you and I talked about earlier on in the week as well. So obviously there are issues here around capacity of testing, there are issues here around capacity around the track and trace system, but this
it doesn't, sadly it always works the other way around. So the reason that care homes have regular testing and things like this to identify the people who are positive but asymptomatic, to exclude them. So if you started doing that in schools, what you're going to do is you're going to identify more people who are asymptomatically positive, and therefore it's going to have an adverse effect on your ability to staff. So what we are looking to do, which won't help, is that thinking about, do we, when there is a number of cases in a school, test everybody rather than just test those with symptoms. Now, the reason for doing that is actually to identify more cases, so then you can identify more contacts and subdue the disease quicker. What it won't do is identify people who can go back to school early. So if we have a contact and the contact is tested, if the contact tests positive, then we would be able to chase the contacts of that person. If that person tests negative, then they still have to self-isolate because it may be that they're still incubating the disease. So it's a bit of a no-win in terms of staffing, I'm afraid. The regular testing is not about keeping people in the workforce, it's more about excluding people.
Okay, and Ginny, just to re-emphasise that point in your question, so I didn't quite read it out as well as I could have done, but Mike's absolutely right. Even if you're a contact and you are tested negative, you still have to self-isolate because the period of incubation is the fortnight, basically. So you would still have to self-isolate irrespective of whether you had a negative test. So that doesn't make any difference to the current arrangements.
And Liz, do you want to just jump in with your related comment about asymptomatic people?
Yes, please. I think, as I understand it, Mike, you're saying if we were to test, and you and I have had this conversation previously, because I remember Dudley Council were testing their staff when they went back in June, and you and I had a conversation around the effectiveness of that strategy. As I understand it from what you have just said, what you don't want to happen if we have mass testing is that we recognise asymptomatic cases. The implication of that, as I understand it, is that if someone is asymptomatic, actually then they pose less of a risk. Are they, because clearly if they did pose a risk, we would want to be identifying them. So therefore doing testing would be an advisable strategy. Can you clarify that, please, about people who are asymptomatic?
Yes. So from a public health point of view, you want to test everybody really, really regularly. And anybody who tests positive, you want to isolate, and then you want to test all their contacts. So from a public health point of view, you really want to test everybody. But that's going to get loads of people out of your system very quickly. So yes, you should be testing everyone from a public health view, but only to exclude. It isn't a way of keeping people in the system. So the position that we are thinking how we can move to is that where there is more than one case in a bubble, there may be lots of other cases who are asymptomatic within that bubble, and we would be testing them in order to find more cases so that we can find more contacts. We wouldn't be looking for negatives to allow them to sort of get back early, because that wouldn't happen. So there is an issue about asymptomatics, and from a public health point of view, identifying them will allow you to better control the disease by identifying more contacts and by excluding them.
So, but what you're saying effectively is we could have a member of staff in school that was asymptomatic, who actually potentially is not going to pose a huge threat of spreading the virus to other people.
But they are going to be a threat. They are a threat. So, but at the moment we haven't the ability and the capacity to test everybody regularly. That's what they do in care homes. So in care homes at the moment, we're testing everybody every week. On the off.
Yeah, I get that. I'm just unclear as to why that wouldn't be a sensible strategy in schools if asymptomatic people, I mean, is it or is it not the case that if you're asymptomatic, you shed less virus than somebody who is symptomatic?
Yes, but you still would have to isolate. You still shed virus, and the question. So there remains the question about in what is still quite a low prevalence area, are these people who've had the virus a long time ago and carrying dead virus? There's quite a lot of false positives. What do you do if they stay positive for quite a long time? So there's quite a balance around it. It is, and also the main problem is if they're negative, that doesn't mean they're not going to be positive the next day. So it is no, it's no substitute for good social distancing, good hand hygiene.
Hand hygiene. So that then, if potentially then you have somebody who is asymptomatic, then hand hygiene and heightened infection control, including sanitising, including wiping down surfaces and contact points, is going to be enough to mitigate that risk.
No, it's not, but it's the best we can do at the moment.
Okay.
So at the moment, there are no plans to widely test everybody in school.
So the bottom line is we could have asymptomatic staff in school who are running amok.
Yes, and that's why social distancing is absolutely critical.
Okay, thank you.
Okay, that's really helpful debate. Thank you very much, Liz. And going back to the point that the best way not to get coronavirus from somebody who's got it is to stay 2 meters away from everybody. And that's the consistent message, isn't it? Which is complicated in schools, which we understand really. So I'm sort of running up and down the list, so forgive me.
There's a couple of questions about before and after school clubs.
Yeah. Alex, do you want to come in here on those?
Yeah, I can do. So I think the question relates to sports clubs, and we have had a few queries into the school comms inbox about this today as well. So what I understand from the guidance is that sports clubs that are part of the curriculum can continue, whether they are delivered by an external provider or internal staff. But if they are extracurricular, before school, after school clubs that are not there solely for the purpose of childcare for working parents, those looking for jobs or respite, then they should be suspended for the lockdown period. So the usual after school clubs shouldn't be happening unless they're for childcare. But during the school day, if you've got external coaches that come in and deliver PE, that kind of thing, then that's absolutely fine.
Okay, great. Mike, there's a question here about...
Yeah, next to it.
Sorry. Mike, there's a question here about your opinion on not closing schools down during the lockdown period and the impact of that on the reduction in the R rate.
Yeah. I think that there is a big impact of schools on the R rate, probably between about 0.2 and 0.5. That the level of the R rate at the moment is probably something above 1, but not a lot above 1. So I've seen different things between 1.03 and 1.3. So probably in Essex, it's somewhere in that line. We know that by getting everyone to work from home, that can push the R rate down by between 0.2 and 0.4, which is what we were trying to do with our tier 2, and also by household contacts not meeting, that'll push it down again by 0.1 to 0.2. Closing hospitality, another 0.1 to 0.2. Closing gyms, leisure centres, beauty salons, another 0.1. So there is sufficient activity and restrictions in the system to easily push down the current R rate below 1 without having to close education in either schools or universities. So if it doesn't work, if it fails, and if the R rate stays above 1, which I think is scientifically and mathematically unlikely, then we might have to revisit it. But at the moment, there's enough interventions and restrictions out there to comfortably pull the R rate below 1 without having to close schools. If that makes sense.
It does. Thank you, Mike. If the lockdown continues, though, do you think that may be looked at, Mike?
I think it depends how we're getting on, where we are. So I think if we turn the curve entirely around, then it won't be needed. If we're and we have this consideration around the tier 2 thing as well. If you turn it almost around, but there's a little bit more to go, what would that little bit be? And it may be that you'd move some teaching, like university teaching entirely online, for example. I think that what's going to happen though is we are going to sort of crash into universities going home at Christmas at the same time we pull out of this. And it's very, very difficult to predict what impact that might have over the coming weeks on the R values anyway. If those people mix all over the place, then it's going to be problematic. If they take a very sensible approach and don't mix, then it could be very helpful.
Okay, thank you very much, Mike. So there's a question here around a parent who refused to get their child tested as their older child found it very upsetting. What do we do then? It's the same advice as we've had all the way through. If you have a pupil who is showing signs of, displaying signs of symptoms, you send them home. If the parent will not get them tested, then they must remain home for 2 weeks. And that's the trade-off really between them coming back earlier with regard to having a negative test or remaining at home. But if you as the school send a child home because in your opinion they have coronavirus symptoms, then you're determining that they can only return with a negative test. And if they don't get a test, they still need to remain off for 2 weeks. That's right, isn't it, Mike?
Yeah, and even now, even though we're seeing much higher positivities than we were perhaps when we first spoke some months ago, the positivity is probably only about 10% still. So still, if you've got symptoms, you've only got 1 in 10 chance of having the condition. So it's certainly worthwhile parents getting their child test because most will come back negative.
So could we just cover off what to do for contact tracing if that's the case, Mike? So if the parent doesn't want to get the child tested, do schools need to do anything with regards to the bubble that child is in if they haven't technically had a positive test?
So generally, that's a really hard one because generally speaking, you would not exclude the bubble until they did have a positive test. So on that argument, you would assume that you would, that the chances are it's at the moment still 9 times out of 10, it's not a positive test. Therefore, my advice would be that it would not be appropriate to exclude the whole bubble at that time.
Okay. Thank you. Pam, do you think we've answered all the questions about sports clubs and wrap around before and after school? I'm just having a look at them. Alice, can you have a...
Claire, I don't think you have. There have been a few that come in, and this is going to vex quite a lot of people, I think, because of the complexities around. So I think it is worth going through this because, for example, a school may have, as we've got here, an after-school sports club. It's not childcare as such. It's carrying out a childcare function, I guess, because the children are there and not at home, and it's extending it and giving them physical exercise. So the current guidance says, you possibly shouldn't do it unless it's childcare. So if you just rename it Childcare Football Club, can we get away with it? That's sort of the crux of it. And the same with one-to-one tuition, although I guess that comes into part of your curriculum offer. So it's around the nuances, I guess. Nobody wants to get it. Have a look at those.
Okay, can I cover this one, Claire? I think my understanding of the guidance, and I have escalated this up to our DFE colleagues, is that tuition can continue, but the clubs, unless they are for the primary purpose of childcare for working parents, then they shouldn't continue at this moment in time.
Alex, can I just ask him that? Have we got, I know we've got until about the 9th of November or something to get our risk assessment stuff in place. I've read that somewhere, that's a key date. So are we able to continue at the moment, bearing in mind we had this information 24 hours ago, as we all have, to continue what we're doing at this point and not get into trouble until you get further clarification from the DFE?
I would say with regards to clubs, the guidance is very clear that unless they're for the primary purpose of childcare for working parents, they should stop. So I personally would stop them now.
Joyous, okay, thank you.
Thank you.
Okay, not quite the answer you wanted, sorry, Nick.
Sorry, Nick.
Wrong answer, Alex.
Try again.
It's just another bunch of complaints, don't worry.
I know, but you're following the guidance, and we are in a national lockdown. So don't forget that's got your back. We are in a national lockdown. The rules are the rules. Everybody's being asked to follow the rules, and the rules are telling you can't run these clubs. Ultimately. So very much, and we'll add that to the parent letter. So we'll do something very clear about what the rules are and what schools can and can't do. So we'll make sure we make that very clear for you as well. So I think that does cover that. We've got a, just on that one though, Claire, hopefully we've answered that now, but piano teachers, yes. So peripatetic music staff and sport coaches and so on and so forth can continue to deliver as part of your curriculum. Your curriculum within school and your school hours is the same as it was before the national lockdown. That's correct, isn't it, Alex?
Yeah, that's it.
Yes, you don't have to
Guidance
change
from the
anything.
music service that we'll send out in the next comms. So music have done an FAQ for you, so we'll send that out.
Right, thank you. So the question about respite, so respite care can continue. That was in the guidance as well. So we will make sure that's very clear. But yes, families who have respite support access respite support, because that's going to be absolutely vital with regard to that. We've done the booster clubs, we've done the issue about complaints, so we'll try to respond to that. As I've just said, we are operating in a national lockdown, so you are required to follow the rules, and we will continue to put those up to the DF as well.
There was a question about school meals.
Yes,
Yeah,
there was.
Covered.
Thank you very much. There was a question about being able to continue to deliver hot meals because you have insufficient catering staff, and can you have cold meals instead? And is that to all pupils or to just those requiring free school meals? That's a tough one to answer, I think, really. My immediate view, but I don't think, Alex, we've thought that one through, have we? Is if you're no longer able to deliver hot meals, then you need to move to an alternative arrangement, because you do have a requirement to provide free school meals, and hopefully your parent community would understand that during the period of this national lockdown. If it's for all pupils, I would suggest if that's the same, so you're moving the current arrangements from hot to cold, I think that would probably be more acceptable if you're able to do that for your parent community, to actually move from for some of your children not on school meals to actually no the school not providing meals at all. So if you're able to, my opinion would be to try to keep the status quo as much as you possibly can. If you can't do hot, then you'll need to revert to cold. But Alex, do you want to contradict me here or give a different view or not?
I wouldn't dare. The guidance is not doesn't have anything about free school meals in it this time, so I have flagged that up to the DfE, because free school meals was a particularly frequent topic last time, wasn't it? But the guidance last time did say that if you can't provide hot meals, absolutely acceptable to go to cold meals. So I think that's what we would say this time as well.
Okay, thank you very much. And then there was just a question, I think, somewhere in the trail about free school meals for pupils at home requiring to self-isolate. There's no change there. There is a requirement to deliver them. Unfortunately, if that's logistically challenging, then unfortunately that is another additional task for schools to manage. Is that correct, Alex?
Yeah, the DfE advice on this one is food parcels, which we know are really difficult to provide. Our other suggestion would be to go back to supermarket vouchers if possible.
Okay, that's very helpful. Thank you.
There was a note on there about advice for the staff that are physically delivering the meals. I'm not sure if they meant serving the meals. Was it a question related to how easy it is to socially distance and that kind of thing?
Yeah, that's right. Thank you.
Thanks. Mike, did you have any advice on those members of staff, because they may come into close contact with lots of children if they're serving meals at lunchtime?
So just to observe the correct kind of social distancing measures and hygiene measures as appropriate.
Okay, right. All right, I'm just going to take the last question on meals, I think, which is around delivering hampers. I mean, I think at the end of the day, with regard to free school meals, as long as you are providing them for the families that are eligible, how you provide them, whether it's food parcels, whether it's hampers, whether it's supermarket vouchers, as Alex has said, again, is a matter for you to determine as part of your risk assessment with regard to that. So what works for you, I think, is how it's always been throughout the period that we're in with regard to that.
Claire, I know you said last question there, but can we just confirm, I think I know the answer to this question, but around Edenred, whether that's still accessible to order vouchers? That's now gone, hasn't it, that option for free school meal vouchers?
My understanding is yes.
Yeah, that's my understanding as well, and I haven't had any emails about it recently.
I mean, I can hardly bear the thought of everyone having to go through the system again, but on the other hand, given that we're now in a national lockdown, is that something that should be pushed back at the DfE again? I know it's different because schools are open, but there will be numerous children at home and who may need to be provided for.
I mean, we can ask the question. I don't think it's going to get any traction, and given the problems that we had with Edenred, you know, there is a be careful what you wish for here type matter, isn't there, as well, Pam, with regard to that. There should be far fewer children at home, but there will be children at home, obviously those requiring to self-isolate and so on and so forth. So I would suggest, if you can manage it locally, that would be the preferable option. If you are struggling to provide free school meals, then again, please let us know and we will see whether we can help you with some alternative arrangements. I think ahead of you're too busy doing everything else to worry about Edenred right now, because that took up hours and hours of everybody's time with regard to that. So I would suggest local arrangements would be probably preferable, Pam. There's a question here though for Mike, I think, which is interesting, around the interface between Essex, Southend and Thurrock public health teams, and discussing with each other about the tiers as staff children cross borders for work, school. And that probably does go back to the fact when Essex moved into tier 2, but Southend and Thurrock remained at tier 1. Mike, as we come out of this lockdown, are there any thoughts about doing something in tandem with Southend and Thurrock?
Thank you. So we always discuss things very closely anyway, so we have been working very closely on this. In terms of the impacts, implications of us being in tier 2 and them not, that was largely around hospitality and largely around people working from home. So it didn't really impact on schools. Because schools' behaviours would be much the same anyway. We would wish that that we will come out in the same place together, hopefully, that we'll all come out into the same tier. And at the moment we're all in the same position anyway. So we always working together, and I suspect that from now on it'll be pretty much aligned in what we do. Can I just say, so I've got to go. Sorry, I think I'm sort of...
We're 1 minute over time. That's absolutely fine, Mike.
Okay, thank you. Sorry, I've gone into the meeting. Thank you.
That's okay.
Yes,
thank you, Mike, for your
you.
contribution and involvement today. Really appreciate it.
Yeah, thank you, Mike.
Thank you.
So I think there's only a couple more questions which I think link to parents. It's really around parents deciding not to send their children back to school during this period of national lockdown, and the school's response to that, really, with regard to that. So this is a really difficult one. We did offer some advice in the FAQs, but again, it's a matter, I think, for you to determine. You know, there will be families for whom there is a family member who is clinically extremely vulnerable, and they will determine that schools are too high risk for their children to attend during this period of national lockdown. So I do think that you know, schools do need to follow that up as to the reasons for non-attendance and what is happening, and why the family's view is different now as a result of last week, and whether any further protective measures could be put in place for their child for them to attend school. There is no requirement for schools to provide home remote education for non-school attendance. But families have been placed in national lockdown. This is outside of everybody's control. So it's for you to determine whether you might want to offer remote education if you're able to, but there is no requirement to do that. So again, it will be a juggling act of what you're able to do and not do. Obviously, you need to manage that in terms of there could be some further gaps in pupils' education when they return. There is obviously support for home education again, and if you need support, we can provide help with that. But it is an attendance matter. But Andrew has said the daily DfE return suggests that you should provide home learning. I mean, Alex, have I said the wrong thing here? I don't. At the moment,
Andrew, do you want to explain that a little bit more, because obviously we don't get to see the DfE daily return format, so you suggest that you should be. Can you just tell us what it says?
Yeah, so if you click that you've got any children isolating, and in our case it's because their family members have got suspected cases, so they're doing the correct thing.
Yeah.
So I clicked yes on the first case, and then it came up with a series of 5 or 6 questions.
Yes.
What work are you providing? How many hours? How many sessions a day? How often do the children have their work marked and reviewed by a teacher? So I went back a step and said, no, we're not providing.
Okay,
because
well.
we're not doing that because my teachers are working flat out for the 29 that are in their class. And for that one child who's off for a day, maybe 2, they haven't got the capacity to do that.
No, I understand the point. So I've confused things. I apologise, Andrew. So there is an expectation for self-isolation that remote education should be provided. So if you've got a bubble who is self-isolating, the expectation is remote learning should be provided. If it's 1 or 2 children because you're waiting for tests and things like that and you haven't isolated the bubble, then actually you're minimising the impact, aren't you? If you can't do it, you can't do it. You've got to do the best job that you can do at the end of the day. So that's Hello? So that is for self-isolation. There may well be, although we don't yet know, the point I was trying to make is there may well be a group of families now, because a household member is clinically extremely vulnerable, who may decide not to send their child in during the period of this national lockdown. And there isn't a requirement, as there isn't for any non-attendance matters, for schools to send remote working home. But you know families very well, so it will be a matter for schools to determine given the individual circumstances with regard to that. So there's a difference between self-isolation and parents deciding that they're not going to send their children to school during this period of national lockdown. Does that make sense?
Yep, fine, thank you.
Great, thank you. So there's another question about a child with an education, health and care plan, wants to stay at home, but it's not extremely vulnerable and wants work sent home. Are we applying the same policy? Again, I think that is a matter for schools to determine. If you are able to provide remote education to families with severe anxiety and members with medical needs within the family, if you're able to do that, then I think that is in the best interest of the family and the school, to be honest with you, in terms of when that child returns. If you aren't, then you aren't, and there is no expectation to do that. If it's the family who are choosing to keep their children at home, that is their choice to do that. And I think we just have to accept and acknowledge that you know, as of Friday, we weren't expected to be in a national lockdown system. So I think we just have to be a little bit flexible and understanding with regard to that. I think, right, there was a question from Mike, which we've lost him on now, which is the furlough scheme being extended, and does Mike think the lockdown will be extended following this period? I think Mike did cover that in his introduction, really, that we are working towards a lockdown of a month at this moment in time, and that's all we can do. And we will be working towards getting Essex out as much as we possibly can. So I at the moment, I think that's a difficult one for anybody to call. I don't think you can make the assumption that the furlough scheme has been extended, therefore lockdown will be extended. Ultimately, I'm not a politician, and nor would I want to be one, but you know, the government have got to manage the health of the nation versus the economy, and we know the economy is absolutely severely impacted by all of this. So so it's a juggling act for them as well with regard to that. Pam, I think in the main, unless I've missed something very obvious, I think we've kind of more or less touched on most aspects. I did say I'd come back to clinically extremely vulnerable, and I think this was around can those staff work, which is a difficult one if they want to, and I know it was asked earlier as well, because some staff have found themselves in that group and they weren't expecting to be. We did talk to Nikki about this, and we did put something in the about this as well. I don't think you can prevent somebody from working who wants to work. I think they should talk to their medical professional advisors around that and get a medical opinion around that. But the important thing is that they were acknowledging, and please come in here, Nikki, that they are attending work against medical advice. And that's the key thing, and you would need to manage that, and they would need to acknowledge that they are attending work against medical advice. Is that correct?
Yeah, I will kind of clarify that in the updated FAQs, and I'm also looking at the individual risk assessment again, and I will put some wording together to include in that risk assessment to reflect that for those individuals.
And Nikki, following conversations with colleagues about this, that I think it'd be really helpful for schools to have, and apologies if this is already out there, but guidance about what questions they should be asking through that risk assessment if they're having that conversation with a member of staff, such as, you know, have you spoken to your medical practitioner, etc., 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 so that there isn't a comeback. I mean, one person said to me rather grimly, but they had a point, you know, if that person caught COVID and died, actually the family might well come back and say that person was pressured into coming back to school and so on. Now, I'm saying that's an extreme position, but schools need to be very careful that they've gone through the proper processes to protect members of staff as well as themselves.
Of course they do. I mean, it's a hugely difficult one, and I think, you know, my preference would be that you say to them, no, you shouldn't come to work, but you know, I think that would be my starting point. But I think at the same time, if there are people, you know, we're in desperate times, aren't we? If there are people who are saying to you, look, I really, really want to come in, and I'm very satisfied that everything is safe, and I've spoken to my GP and everything else. But yeah, we'll make that clear. But I think, you know, the preference is that they don't come to work, but we're trying to cover every sort of option, really.
Yeah, I mean, I think part of the checklist is also offering if, I know it's new, but if there is alternative work for that person, which isn't within the school environment or is social distance within school. But a list of sort of checklist of questions for people to inform a risk assessment, I think, be helpful.
Yeah, we'll make sure we cover that one off. Great.
Thank you.
Is there anything I'm conscious of the time, Pam, but is there anything I've massively missed?
To be honest, Claire, as we all know, this is ongoing. And so as long as everybody knows how to get through to the school comms team, how to raise questions, we've got the 4 EPHA meetings online in the next fortnight. So we'll have the opportunity for more questions there. So I think unless anyone wants to leap in straight away with a burning question, we've covered a great deal, and, you know, very grateful for your time and Mike's.
No, it's a pleasure.
A very quick one, sorry to ask, just, and it's the other head teachers there as much as anything else. Our insurance has already said they won't cover the CEV absence. Has everybody got that as well?
We haven't asked, so.
I think it's for schools to ask, Bridget, but I would have thought that the majority of insurers probably will not cover in-service CEV, because obviously the medical advice is that they should be at home, which is why we need to be very clear about the discussions that you have and about the audit process that you go through in terms of determining whether they're in school or not.
Sorry, no, I meant their absence in terms of will they cover for us to backfill, not will they cover them if something
Apologies,
happens.
Bridget.
No, they are at home. they are at home, but it's just, will they cover for us to obviously backfill those posts so that we've got the right amount of people in school, especially
I'm almost certainly that most of them won't, Bridget.
Okay. I just wondered if we've chosen the wrong one.
It's not sickness absence, and I doubt, particularly in the current climate, that any insurer is going to be keen to cover these sorts of absences. But it's not sickness absence unless it is a particular case where they're off sick. But I doubt that most will cover it.
Okay, thank you.
Great. Okay. All right. So I'm just going to bring us all together. Sean, I've noted your question around free school meals, food parcels and vouchers. So I'll leave that one with Alex to find out. But yes, we can come back to. Again, I think that, we're entering into a second period of lockdown, and I think our advice is remaining unchanged really as much as possible. The guidance is the guidance. And you have to apply the guidance as per your risk assessments. And if you cannot follow the guidance to the letter, or your risk assessment indicates that your school circumstances mean that you would like to adjust the guidance, then use your risk assessment as the audit trail for making those decisions. So you have a requirement to provide free school meals. But I think if it's easier for you to do something different than food parcels, I don't see why you shouldn't do that. Your risk assessment is what drives your decision making. And if you're asked any questions as to why you are or not not doing things, then you've got that documented in the decisions that you've made around your risk assessments. So I think it is being very pragmatic and very practical. And as far as the council is concerned, as long as you've done your risk assessment and updated it, then we will support any questions and any queries that are coming your way around the interpretation of the guidance. So, that remains absolutely as is all the way through. And as you know, I've also given you permission at times to divert from the guidance as well. And depending on where we're at, I will continue to give you that permission to divert from the guidance in terms of what makes sense. You are doing an incredible job for your children and your communities. You're incredibly difficult circumstances, and we just have to get through this collectively together, and so we will have as much support for you as we can, but ultimately you need to make it work for you and your staff and your pupils, and you're juggling a lot. So just pragmatic and logical advice as far as you possibly can with regard to everything. And if you need to raise any questions or want any reassurance, please go through the school communication inbox and we can talk any issues through with you on an individual basis in that regard. So I'll see many of you in the EPHA meetings coming up next week and the week after, and I'm sure that we will carry on these conversations as we move through this second lockdown. But it's been absolutely lovely to spend a couple of hours with you this afternoon, so thank you very much indeed.
Thank you, Claire. Okay, I'm going to stop recording, and many thanks, everybody.